Serving 885,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawadenu people of Kincombe Inlet to Victoria, from Tofino to Comox. We acknowledge with respect and gratitude our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-Chulnith cultural families. The Island Health family includes 30,000 healthcare professionals and 1,000 dedicated volunteers. Over 3,000 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 145 facilities with more than 6,700 long-term care beds, over 1,600 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $3.9 billion. Each year, this funding supports 561,000 visits to emergency departments, more than 73,000 surgeries, nearly 60,000 MRIs, 158,000 CT scans, 2,100 telehealth visits, more than 85,000 visits to urgent and primary care centers, over 17,000 home health monitoring visits, 314,000 visits to ambulatory clinics, and 478,000 home health care visits each year. Island Health has expanded our primary care services with 23 primary care sites across our region, including 7 Island Health urgent and primary care centers and 9 primary care networks. Under the leadership of 6 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 500 inspections of licensed care facilities, and 5,400 inspections of food service operations. Our public health nurses provide nearly 6,000 perinatal home care visits and 30,000 childhood immunization appointments. From birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
Glad that you are here to join us this evening. I'm Leah Hollins, the Chair of the Board of Directors of Island Health, and on behalf of my colleagues, welcome to our public forum, whether you are joining us here in person at the Royal Canadian Legion in Tofino or online through our live stream. We acknowledge and pay respect to the traditional and unceded territories of the Kwakwaka'wakw, Ahousaht, and Ucluelet First Nations. We had planned to have Elder Levi Martin with us tonight to make some opening remarks and start us off in a good way, but unfortunately he's ill, so we weren't able to have him with us. I also want to recognize the Inuit, the away-from-home urban Indigenous people, and the Métis charted community. We do this to reaffirm our commitment and responsibility to improving relationships between nations and cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done, such as the cultural genocide and assimilation of Indigenous peoples, the residential school system, the Indian hospitals, the discovery of graves of Indigenous children who attended the residential schools, and the too many missing and murdered Indigenous women and children, the social inequalities and racism which exist today. I invite you to think about our responsibility to act in a spirit of reconciliation, healing, and collaboration. As a healthcare organization, Island Health is committed to cultural safety and humility. And we demonstrate this through our actions to address Indigenous specific racism, systemic racism, and the ongoing impacts of colonialism. Public forums like this allow the board to meet people and communities we serve. They are essential to our commitment to transparency and accessibility. Our time together will help us better see what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we care deeply about health and care. As a former nurse, I'm always concerned about whether what we are doing is right for the patient. After all, caring for patients is why I started working in healthcare. Caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. It's now my pleasure to introduce you to our directors who are responsible for the overall direction of Island Health. In addition to myself, the board includes Shawnee Cassavant from Hupetchesett and Seychop First Nations on the West Coast, Ron Rice, a member of the Cowichan tribes who lives in Victoria, Diane Brennan from Nanaimo, Ann Davis from the Comox Valley, Ann McFarland from Victoria, Ron Matson from View Royal, and Andy Adams from Campbell River. We have a new board member who's I'm sure feels like he's drinking out of a fire hose as we orient him to Island Health, because you can see from the video that it's pretty large, but he wasn't able to reschedule this meeting, so he isn't here today, but he'll be joining us shortly, and we are very much looking forward to that. We have several members of our local leadership and executive management team here, and you are going to hear from some of them later, but I wonder if you'd just give us a wave, Max and Dieter and others, so that people know who you are. We have a pretty full evening planned for you. Dr. Charmaine Enns, who I'm sure many of you will know, your medical health officer, will speak about public health and wellness in this region. We will then have a presentation from Faye Missar of the Coastal Family Resource Coalition on their work advancing health promotion efforts in the region. The last part of the agenda will be an opportunity for you, community members, who have come to our meeting or submitted questions by email in advance to ask those questions. And I will open the floor then so the board can hear from you. But first, I want to invite Island Health's President and CEO, Kathy MacNeil, who will begin by providing an update on the delivery of health and care services across Vancouver Island, and in particular here in Tofino and Ucluelet. Kathy.
Thank you, and good evening, everyone. It's very nice to see so many people interested in healthcare here in this community in Tofino. I too would like to acknowledge that we are gathering on the traditional territories of the Tlaloquiet and Ahousaht First Nations, and also recognize Inuit, other First Nations from across Canada, and Métis chartered communities who may call this region home and to whom we also deliver care. Before I begin, I want to acknowledge the heaviness of the work being done in the Ahousaht First Nation, searching for missing children at the 2 former residential school sites located on their territory. We stand in support of Ahousaht and recognize the ongoing impacts of colonialism still causing harm to this day. We're working diligently to undo these impacts and strengthen our commitment to reconciliation, supporting those impacted families of the little ones who didn't come home, and importantly, those who did, but were harmed by that experience. I'm grateful to be here in your beautiful community. I always look forward to visiting here and grounding myself with the peace and power of nature. I took the time to go on a beach walk today, and I was just sharing before the meeting started. Every time I'm on the beach in Tofino, I'm reminded that beauty and the awe of beauty and challenge and the power of nature can coexist together. And it's so grounding to be here. I'm envious of those of you who get to call this place home. We have a full day planned for tomorrow, and we plan to visit the Tofino General Hospital as part of our visit. I know the hospital staff recently hosted surveyors for the accreditation assessment of Tofino's emergency department and inpatient care areas. Accreditation Canada is an independent organization which assesses healthcare organizations in Canada and worldwide using evidence-based standards. The accreditation process is a continuous process of improvement that we engage in as an organization. It's not the only way we assess and improve our services, but it is vital to improving our care. The accreditation surveyors told us that they saw more great stuff than challenges when visiting the Tofino General Hospital, and the team members that they had the chance to speak with were enthusiastic about their work and committed to working together to improve care delivery. I'm sure those of you who live here know that about the team here in Tofino. I want to take a minute to thank the staff and physicians at the hospital for their ongoing commitment to delivering excellent care and their focus on improving patient safety and the experience for patients and families. I'd also like to take a minute to thank Sarah Gogo, who's the site director at Tofino General Hospital, and Dr. Carrie Marshall, who's the medical director, for the incredible work and leadership that they provide. I see them standing in the back. They're very humble. They don't want to wave here. I also want to take a moment to thank the Tofino Hospital Foundation for their hard work, and I see some members here with us tonight. I recently read the story about Vera Morrow, a retired nurse, who donated $200,000 to the foundation. This was an incredibly generous gesture, and I believe it's the single largest donation that the foundation has ever received. So more catalyst for a new hospital for this community. Like many areas across the island, healthcare challenges have affected Tofino General Hospital, especially in retaining and sustaining the workforce that we need to deliver care. Over the past few years, our leaders have seen an increasing need to address recruitment and retention to ensure that we have a workforce that's resilient and ready for the future. Over the past 12 months, we've hired 17 new staff at the Tofino General Hospital, including 4 nurses. Our medical staff recruitment team is also actively working with our partners at Health Match BC and the Divisions of Family Practice to increase awareness of the need for physicians in the Tofino area. This includes actively recruiting for a family physician on the West Coast who will provide primary care services to Ahousaht Medical Clinic, Tonquin Medical Center, Ucluelet Medical Center, Hitatsu Health Center, and Tai Histanis Health Center, as well as the emergency room and inpatient care at Tofino General Hospital. If you know of anybody who's interested in all of those wonderful experiences, please let them know we're hiring. Additionally, rural and remote nursing incentives are available for registered nurses and registered practical nurses interested in relocating to Tofino for a position. Please let your friends and family know that the province of BC and Island Health recognize the need to provide incentives for rural communities as part of a larger strategy across the province. Recruitment and retention incentives have recently been announced, and the importance of retaining the wonderful staff that we already have in these communities. We know there's a need to address the aging infrastructure of the Tofino General Hospital. We are developing a concept plan that will assess those needs and provide recommendations for the modern redevelopment of the Tofino Hospital. The concept planning process includes a broad review of health services needs beyond those provided in a hospital setting to ensure the plan to replace existing infrastructure fits as part of a comprehensive approach to meeting the entire population's needs into the future. We carefully study population data and what these communities need, including the desire for more community-based services and long-term care. We will be submitting a concept plan for the hospital to government in this summer of 2024. The next step following that would be the development of more detailed business case where engagement with partners begins in earnest. I'm thankful to the local medical staff supporting Tofino, Ucluelet, and the Howsett communities. This dedicated team provides exceptional care to those in the region, supports the plans for growth in Indigenous communities through the primary healthcare initiatives work, and has been essential to the West Coast General Hospital Emergency Department in Port Alberni. I know these staff consistently go above and beyond to ensure services continue to be available in this region, including Port Alberni. I know it can be difficult to travel to receive care and healthcare services. It's common for those living in remote and rural settings across British Columbia to have to be able to travel to places like Port Alberni and beyond for care. We're thankful to staff in other parts of Vancouver Island as well, and the Lower Mainland. Emergency department nurses, lab staff, diagnostic imaging staff, and physicians who continue to choose to come and fill shifts in many smaller communities such as Port Alberni, Cormorant Island, Port Hardy, and Port MacNeil. I can't express enough gratitude and appreciation for their efforts and dedication to serving the Centre West Coast region and the North Island region, and for their commitment to ensuring our patients can continue to access care. Primary care centres are part of a comprehensive strategy to transform BC's health system by coordinating with healthcare providers, services, and programs to make it easier for people to access care, receive follow-up, and connect to other services they may need. We're working closely with our partners, including the Division of Family Practice, the Ministry of Health, First Nations Health Authority, local care providers, to expand primary care services across the West Coast. In January, we announced we had secured a partner for a healthcare center to be built in Ucluelet. This center will co-locate Island Health wraparound services along with private practices. Island Health's community-based services in the region, including community health services, mental health and substance use, and public health, will move to the new center next summer. The central location will offer several benefits to clients and patients, such as a more accessible access to multiple services and programs, team-based care, and improved communication between care providers. The center will be used by a team of health providers, including physicians, nurse practitioners, and Island Health staff who work together to provide primary and community-based services for the local population. We also know that the Long Beach Rural and Remote Division of Family Practice is developing a primary care network to ensure patients have access to timely, comprehensive team-based care. We are excited to see the work of the 5 local West Coast First Nations in developing a First Nations primary care initiative in the region that will see in-community-led services designed to address the unique needs of their nations, as well as support for more consistent service provision to the communities. It's wonderful to witness the collaborative efforts of these nations who are dedicated to advancing their work in a manner aligned with their unique needs. It's a powerful demonstration of Indigenous self-determination in healthcare. And while there's much work to be done, it's an encouraging step forward. We know another challenge this community faces involves hospitalizations caused by alcohol consumption, which climbed drastically during the pandemic. Tofino and Ucluelet hospitalizations due to alcohol are 4 times higher than the rest of Vancouver Island. Dr. Enns, I'm sure, will be talking about this later. We know we need to better support people with substance use disorders. One of the ways to help with this is by improving access to sobering and assessment services within the community. This type of service is critically important in supporting the start of the journey towards recovery and treatment. The lack of a sobering and assessment service here in Tofino has long been recognized, and we are continuing to work towards developing the sobering assessment site for those who require a safe space following substance use. Currently, sobering and assessment is frequently carried out in the Tofino General Hospital Emergency Department and will continue to be so until a more appropriate space and program is available. Before I finish, I want to acknowledge the great work local governments, organizations, and our community partners are doing to build healthy and robust communities. In my career, I've realized that building a strong community, that relationships are critical to building a strong community. Relationships between healthcare providers, patients, families, community agencies, governments, and health authorities. None of us can do this alone. Working together as a team is essential for a healthy community. Those of you in the room who are participating in this work, thank you for leading this effort and advocating for the health and wellness here in your community. We're going to hear from the Coastal Family Resource Coalition in a few minutes, and I also want to thank them for their work advocating and promoting health efforts here on the West Coast. As you saw in our video, our vision at Island Health is to provide excellent health and care for everyone, everywhere, every time. We don't always achieve it, and that's why it's a vision. It's our North Star. It guides the hardworking and dedicated Island Health teams in their daily work. Local collaboration and partnership make a tremendous difference to them. I know our teams appreciate the support and interest of the community in their work. I speak for my colleagues when I say how grateful we are for the partnerships and collaboration and how proud we are of this team that serves the health and care needs here on the West Coast. Clicco, clicco. Now I'd like to pass the podium back to you, Leah.
Thank you very much, Kathy. I'm very pleased to invite Dr. Enns to the podium. She's the medical health officer for this area, and she's going to provide an update on the health and wellness of the population in this area. And before you start, Charmaine, I have to say this. We forget how important population and public health is to us as people. The reason we have clean water, the reason we have vaccines, the reason we have all kinds of things like that is because of population and public health. So we tend to focus on acute care and long-term care and some of the other buildings that we have, but really we need to remember how important population and public health is. So thank you.
Thank you, Leah. Thank you very much. I want to thank the board and Kathy for the invitation to be able to give a presentation to the community. I want to thank the community for being here, both in person and those who are on participating virtually. My name is Charmaine Enns. I'm one of the medical health officers on Vancouver Island. I'm a public health physician. My main area of responsibility is the North Island, but I'm temporarily the interim medical health officer for this area. Very unique for me because this is home, and it has been home for coming up to 26 years now, so feels kind of strange. So I'm going to start by saying, oh, where's my clicker, Tyler? Oh, yes. See, I'm feeling the stress of being in my own hometown. As much as possible, I'm going to provide indicators that give a high-level taste of the health of the population. Some of the indicators, due to the size of the population on the West Coast, aren't possible, so it's for the Alberni-Clayoquot local health area, and as much as possible, I'm going to bring it down to the West Coast. So when I will refer to them in that way, if it's Alberni-Clayoquot or if it's West Coast. So, what am I doing wrong? Click the down. Want to recognize, I appreciate the territorial acknowledgement, but I also want to recognize that we're on the homelands of the Nuu-chah people, which is home for the for 5 nations, the Cloaquet, Ucluit, Ahousaht, Heshquit, and Tokart First Nations, and also within these territories, Ucluit and Tofino are 2 other communities. If you haven't seen this totem yet, this totem is on Anchor Park, which is it called Anchor Park? Yeah. Just down the road here on the left on the water side. It's a really beautiful totem. So population and demographics. We're unique here. You can see the pie graph it's hard, I'm sorry about how small things are, but just to quickly explain, the pie graph is a breakdown by age groups. The purple, which is most of our population, is the 20 to 44-year-old age group. We are a young population here on the coast, and the median age is 35.5 years, so very young. You guys okay? You're feeling like you're not in that age group? It's okay. You're represented in one of the other colors, so you're there. And then I just want to say, unlike other communities too, the fastest growing population in this area is the 45 to 64-year-olds. So over the next 20 years, that blue line, that graph, is the population estimate growth, and that's in the 45 to 64, which is the 20 to 44-year-olds moving up 20 years. One other thing I just wanted to say, while I'm just giving a really quick overview, I also want to acknowledge the Clayoquot Biosphere Trust and the 2023 vital signs that they did. It is an excellent report, and I actually think if you want to learn more about specific health indicators and other indicators of significance for us on the coast, to reference the vital signs. Life expectancy. The 2 top lines represent the life expectancy for Alberni Clayoquot and Island Health. Island Health in BC in the top, and then the bottom one is the life expectancy for Alberni Clayoquot. We're 4 years behind in life expectancy to the rest of the island. And you can see what's happened over the pandemic years, how that life expectancy has dropped even more. Just to unpack that a little bit, I'm going to talk about something called potential years of life lost. I like potential years of life lost because it's an indicator of premature death. So if we look at a reference age of 75, bless you all if you can get to 70 plus 5. But not everybody, unfortunately, does. And so this is a very important indicator for premature deaths before that reference age of what's expected. And often when we look at those factors that are contributing to potential years of life lost, we have opportunities for intervention because a lot of these factors have a mitigation. So the top line is for our area, Alberni Clayoquot, and it is twice that, more than twice that, compared to the island and BC. We have a lot of opportunity to reduce premature death. What's driving premature death? I don't have a lot of detail, except that most of it is to unintentional injuries, and within unintentional injuries is the drug poisoning crisis. This is important because while this isn't specific to the West Coast, it is Alberni Clayoquot. The poisoning crisis in Alberni, for all of us, we have a lot of mobility between Port Alberni and the West Coast. Whatever happens in Port Alberni for a premature death affects all of us because they're often our family or our neighbors, they're people we know. So while it might not be specific to the West Coast, the drug poisoning crisis, which is really impacting Port Alberni, not so much on the West Coast. In fact, in 2023, within the Alberni Clayoquot, we had 36 deaths from drug poisoning. 1 of those deaths was West Coast. That doesn't mean they're not West Coast people, but those deaths are really happening in Alberni Clayoquot. And that's what's driving our potential years of life lost. This doesn't need to happen. Okay, then I'm going to substance use. I kind of just talked about it. But concern for the West Coast in terms of substances, and the psychoactive substance is alcohol. When you look at this graph, this is from 2017 to 2023, the purple is the admission rates to Tofino General Hospital by West Coast residents. This isn't the million visitors, literally a million visitors. This is the people who live on the West Coast being admitted to Tofino General Hospital. The purple is for West Coast General for Tofino General Hospital. The blue is for Island Health overall. And the other two little bars are for the opioid crisis. It's alcohol that's impacting hospitalizations. Hospitalizations are the tippy end of what happens with alcohol consumption. Harm is directly related to consumption. This represents very high consumption. The consumption on the West Coast is very high for alcohol. Tofino has taken the lead as the municipality in developing a Tofino alcohol policy. It's a good policy. It's based on solid principles. And the purpose, of course, is to reduce the public impact in public spaces of alcohol consumption. This is a really great first step, and if you're local and you haven't seen the policy yet, I would suggest you have a peek. So it's not a surprise to all of us. We are heavily impacted by tourism, and tourism is impacting all of us. As a community, it is, I have to look at my notes because this is so important. This is not just a resort town on Vancouver Island issue. This is a global issue with over-tourism and the impacts in some specific communities with over-tourism and what that's doing for the health of the community. So there is an inverse relationship between the number of hosts or guests, between the number of guests or tourists to the number of hosts or residents. So the more residents, the less residents to the number of visitors, the more perceived impact there is on your quality of life. So when we get 1.2 million visitors to the park last year and 2,500 people live in town, that's quite a discrepancy between the number of guests to residents. And this does impact the people's perceived quality of life and satisfaction. It also has other impacts in terms of the inequitable distribution of wealth and money. It is very expensive to live here. The median price of a home in Tofino is now $1.6 million. 25% of our residents in Tofino are not homes, they're short-term rentals. People can spend a lot of money to buy a house that's going to be a business, make money. You can't pay that kind of money to call it home. So we have over 51% of our population do not make a living wage and yet live here on the West Coast. So there's lots of, some positives, lots of challenges with the amount of tourism and visitors to the coast. And of course, not even touching on the ecosystem and environmental and resource issues. Again, the vital signs report really speaks to that. I'm almost done before Tyler pulls me off. It's not, I'm pressing the button, Tyler. Thank you. This is an important one, just kind of speaking to what I just spoke about housing. This is called, it's a deprivation index. It's called residential instability. And what that means is it's most often a deprivation index in large, densely populated communities. This is a very unique situation where we have a very high deprivation index for residential instability here on the West Coast. And 54.5% of the population are residentially unstable. That has impacts on health and wellness and stress and not only on the individual, but also developing and maintaining community and connectivity and connection. Drought levels, we live in a rainforest and we have drought. So this looks at from July 1st to October 1st of 2022. You can see Vancouver Island on the bottom there. We go from normal levels to the highest impact of drought levels over the course of those months. We are heading into a year where we have had the lowest snowpack on record going into this year on Vancouver Island. We expect more drought than we had last year. What comes with drought is not only our water supply, but also the risk of fires. So it is really important that we prepare, not only prepare, but we adapt. And by adapting, that we're conserving all of the time. So it's a hard thing to get around to think about conserving in a rainforest, but we really need to conserve in a rainforest. And only of the 8 water systems on Vancouver Island, 3 have submitted drought plans, so we need to make sure all of our water systems have drought plans. My final slide is about youth. Youth really took a hit over the pandemic years. Our pandemic response did a significant amount of harm to our young people. And what's highlighted there in that box is the percentage of youth who report good health according by grades 7, 10, and 12. And so for the Pacific Rim, for this area, you can see that's just a bit lower across all of the grades, reporting less mental health. What's the word I'm looking for? They're not reporting their mental health as good as other areas. However, the Clayoquot Biosphere Trust, in their youth survey, which they do every 2 years, went into the 2 high schools, one in Ucluelet and one in Howsett, and did a survey of 55% of the youth responded to the survey. That was 169 kids. 87% of those youth said they are able to participate in activities that bring them happiness. That's good. 97% of those kids said that they have somebody in their life that cares about them. That's fantastic. And 83% of those kids said, I'm a happy person. So that gives me a lot of goosebumps. That makes me really happy. You can still be happy and stressed though. So here's the other side that I wanted to share, that of those same youth, 66% of them said they're more stressed than ever, and they feel stress all the time. That's almost double from 2018. And also of those same respondents, 58% of them said they're really anxious and worry a lot. That's 58%. That's up from 21% in 2018. So we really need to keep supporting our young people. In conclusion, just to summarize the big ones, from my perspective as the public health physician, that we have opportunities where we need to prevent and address alcohol. And as much as I'm appreciative of the Tofino alcohol policy, I think we have opportunities to make it even stronger. Tourism, this is an ongoing issue for us as residents. I want to thank our mayor and council for the hard work and the staff that they do to help refocus us back to being a community and what that means to be a sustainable community, and for our First Nations in guiding us on that path as well. And drought. Climate change is not a surprise. It shouldn't be a surprise. Let's not be surprised. Extreme climate, extreme weather events, it's going to keep happening. So as we prepare for and adapt, so that the generation behind us can keep calling this home, we need to take these opportunities and do them to the best of our ability. So thank you very much for the time and your attention, and I'm grateful.
Well, that was pretty stark, Charmaine. Thank you, because we all need to know that. What you said was so, so important to all of us, so thank you very much for your presentation. I always appreciate hearing what you tell us about what's going on in population and public health. And now we're going to move to a presentation about the Coastal Family Resource Coalition. The coalition promotes health and wellness on the West Coast, aiming to advocate for and advance health promotion efforts in the region. And so I'm very excited to welcome Faye Missar, who's the community developer for the coalition. And just before you do it, come on up, Faye. But I just wanted to note that when we have a presenter like Faye, the board gets an opportunity to ask questions of her before the audience does. So I'm just going to take that opportunity once Faye's finished, and then I'll ask you if you have any questions. Thanks, Faye.
Thank you. All right. Just adjust to my proper height. Thank you. Thank you. Yeah, can everyone see me okay with this? Okay, great. Thank you so much for the invitation to present today. I'm truly honored. My name is Faye Massar. I'm the community developer for the Coastal Family Resource Coalition. I live in Ucluelet in Ucluelet territory, and I grew up there since I was 2, and it's an honor to be working here in this role. I do my own slides. Okay, great. The coalition, it's the Coastal Family Resource Coalition. We just simply call it the Coalition. It's a regional interdisciplinary network of health and social service providers. We work together to develop capacity in addressing the needs of children, youth, families, communities on the West Coast by improving communications. And our overall goal is to improve health in our communities. It was formed in the early 2000s in response to provincial funding cuts made to almost all human service sectors and the reduction of services, particularly in our communities. The service providers working in the West Coast saw the potential for conflict and competition in this time. So instead, they decided to work together to secure the services we need, make the most of what we have, and to act on what we know about our communities. So we do this work mostly through our monthly coalition meetings, first Wednesday of the month. They're held from September until June online, and then also in person in alternating communities to provide an opportunity to network and share information. With the overall goal of increasing collaboration and reducing service delivery duplication. We also have an opportunity at each meeting to identify community health priorities, needs, and gaps. Community members are always welcome to attend to the meetings to learn about programs and also to identify community health priorities that are important to them. We have 3 working groups which dive deeper into issues relating to children and youth, harm reduction, and our early years. These groups meet a few times a year and sort of act as mini coalitions. There we go. And they're often utilized as focus groups for new programming coming into the region and or to initiate new programs for the region. So often a new working group might get struck at with an opportunity to bring in funding to start a new program. So I bring all of the health priorities and pertinent information that's shared at the coalition and working group meetings to the local planning committees that I sit at as a representative of community health. So part of my role is to liaise between communities and health leadership to advocate for our local needs and gaps. We have a few funders, the Clayoquot Biosphere Trust, which has already been mentioned by Charmaine, the Ministry of Child and Family Development, and Island Health via the Alberni Clayoquot Health Network. However, I would note that our funding is fairly bare bones and we're always looking for more funding partners. We also host the West Coast Literacy Program, which aims to promote English, French, and Iqaluit language and literacy development, which we know is an important determinant of health. Every few years, we also host a regional health forum called the Coming Together Forum. Our last one was in 2022 in Tofino, and over 80 people attended from across the region to dig into some of our more persistent health challenges. For the first time, the Youth Advisory Group of the Communities Building Youth Futures program organized a youth panel discussion and spoke about health topics of importance to them. And now that you kind of understand who we are and what we do, I'm just going to give an overview, a high-level overview of the health priorities that were identified at the Coming Together Forum and as well at our monthly coalition meetings. Child and youth services persists as one of our top health priorities and has for the last several years. Youth in the region need better access to primary care, mental health, and substance use services and supports. During the youth panel, youth discussed the difficulty of accessing doctors and counselors, and the idea of a youth clinic arose and has since been initiated by Nurse Karen. So thank you, Karen, and Island Health, Public Health. Youth stated they wanted access to different kinds of therapies, including nature-based, arts-based, dance-based therapies. Access to psychiatry for youth with more severe mental health issues is also needed. Youth also stated that they want healthy leadership and support about substance use from a young age. They're not satisfied with their sexual health education. They want education about sexual relationships, healthy relationships, connection, and consent. They also want to know where to go for more information about STI testing and where to get an abortion. Access to consistent, ongoing recreation and youth programs are needed. This has also been a long-standing priority in the region. Safe spaces to hang out came up a lot in conversations. These spaces can be anywhere, library, restaurant, youth centers. They can be informal, but they require leaders and facilitators. Therefore, healthy adult and young adult role models are needed to run these groups. Connection to land has also emerged as a priority for youth. And then recently, didn't make it on the slides, but actually did, at a coalition meeting, the need for speech and language pathology arose as a need. And some of you may know that Port Alberni has been selected as one of the new sites for Foundry Youth Services, and we did partner on their application with them with the promise of outreach services to the West Coast. So hopefully more of these gaps will be addressed moving forward. Transportation. Long-standing need in the region, and something that we're so happy that a bus system connecting the communities has started this month, and we hope for extended hours of service if and when BC Transit does get on board. Great. As health professionals, we know that public transportation is a harm reduction and health promotion strategy. And although there is medical transport for to island health facilities outside of the region, transport for medical appointments within the region is still a gap potentially being filled by the transit system or the bus system. Maybe not. Time will tell. Okay. For equitable rural and remote health services, funding models need to be designed based on need, not simply population size, and also need to consider the high influx of population that we receive with tourism and seasonal workers. There is a need for core funding to sustain programs over the long term rather than funding for pilot programs, which we see a lot of. In terms of infrastructure, priority spaces that have emerged from discussions and have already been touched on a few of them tonight: long-term care facility, detox and sobering center, shelter housing, housing for staff, a new hospital in Tofino, and a Ucluelet health clinic. Access to primary care, particularly access to physicians, mental health and substance use and harm reduction services, and lab services emerge as top needs in this category. At the Coming Together Forum, participants identified the need for more full-time equivalent allied health professionals, including home care services and nurse practitioners in the region. They expressed the need for increased walk-in clinic hours and healthcare access at schools, as well as nurses in primary care clinics. Yeah, and lastly, and sadly, healthcare providers report feeling burnt out due to heavy caseloads, staffing shortages, and funding and infrastructure gaps that negatively impact their ability to provide patient care. And I did forget to add food security as a big one that comes up at most of our coalition meetings. Particularly, have been talking about a meal service, like a Meals for Wellness. Yeah, I want to say Wheels for Meals, but that doesn't seem right. So we are in conversation actually with the hospital around providing like frozen meal type program for residents in need. We have one food bank in the region. It's in Ucluelet, and a high number of users from Tofino. So we definitely need to collaborate around food security. Yeah. Again, thanks so much for this opportunity to share about some of the work that we do and some of the health issues we're advocating for. I'm open for questions.
That's great.
No pressure, though. I don't need to take the questions. It's fine.
Thanks very much, Faye. I just want you to know how much we appreciate the work you and your coalition does. So please pass that on to your colleagues as well. Thank you. Now, I want to ask any of my board colleagues if they have any questions to Faye about the coalition before I go to the audience. Anne McFarland?
Yes, thank you so much.
Can you use a mic?
Thank you so much. It was a great presentation. There were two areas that you mentioned that really are the purview of education: speech therapy, and the other one I forget, of course. I was wondering, do you have adequate participation by educators and people from the education community in your coalition?
Not always would be the best answer I could give there. There is actually a job posting for a part-time speech pathologist through outreach therapy in Port Alberni, but the position would be locally based on the West Coast. Just needing to find someone who can afford to move here, and find housing.
Thank you.
Yeah.
Ron Rice?
Thank you so much. You mentioned consistent funding and sort of the overabundance of pilot programs. Off the top of your head, what's one of the most successful pilots that wasn't funded?
Oh. Actually, the Communities Building Youth Futures is happening right now, and Alberni Clayoquot Health Network has extended the funding for another year, and we are looking for ongoing funding for that program to really, it's like a regional youth facilitator role to help create these safe spaces for youth in each of the 10 communities out here, and to, at our youth working committee or group, we meet to connect all the different youth workers and youth counselors, and we identify priorities, and we talk about things like youth crisis housing, harm reduction services for youth, and then because a lot of the jobs are part-time, no one actually has the capacity, myself included, to get these priorities off the ground. So this role that Tony Buston has been in, which is funded through the by the Tamarack Institution, has been great for actually taking what we're talking about these at the committee level and bringing it into action. But of course, it was a 3-year pilot program, and ACHN is extending it. But then we're still looking for more sustainable funding for that. Thanks.
Great. Well, thank you very much. Don't get discouraged. This is great work. So keep it up.
Never
I just want to
discouraged.
turn to the audience first and see if, did someone else have a question?
I'm just interested in knowing how frequently you are able to obtain funds for the pilot projects that have been successful and have them continue.
Not very successful at the coalition level itself, but then really we're a network. So within that network are many different organizations and community programs, and some of them have been more successful than others. But rural and remote people are less healthy than their urban counterparts for many reasons. One being lack of funding, I would say.
Thank you. I suspected that was the answer, but it's. I think it's a good idea to say it out loud, so people hear actually that they've been successful, but were unable to continue because of lack of funding. Right. It's really important.
Thank you.
Thank you.
So now I am going to ask the audience if they have any questions of Faye. I suspect that many of you in the room here know Faye fairly well. But please, if you have any questions. Well, thank you very much. That was
Thank
excellent.
you. Thanks so much.
So now I'm just going to open the floor to general questions, and I'd ask that you keep your questions brief, 1 or 2 minutes, so we can answer as many as possible before we adjourn at 7:30. I don't know whether we've received any questions from our online folks or not. I guess I don't need 2 mics yet. No? Okay. So, open to you. Questions? Please go ahead. There you go. That's what the mic's for.
Thank you. Excuse me. I'm the chair of the Hospital Foundation in Tofino, and my question is, you have started with a concept plan for the new hospital. Do you have a site in mind for the new hospital?
Can I turn that to you, Kathy?
And I think I'll ask my colleague James Hansen, who's in the room, who's closer to the work. James, are you able to answer that?
Yeah, thank you. That's a great question. The short answer is we don't yet. So what we'll be doing is submitting the concept paper this summer. When we get to business case, we'll work with community and we'll start addressing where and and what that might look like. So there'll be a better chance. I think you'll probably be at the breakfast tomorrow. We can talk in a little bit of detail about it then. But when we get to the business case, which will be the next step, we could, we'll be exploring those options and engaging with community.
Thank you.
You're very quiet. We just met with Tom and some of his colleagues on Friday. Thursday or Friday, Tom? I've kind of got lost in the days. Friday, yeah. So the Association of Vancouver Island and Coastal Communities was meeting in Victoria and had the opportunity, we had the opportunity to meet with many of the municipal leaders there. So that was fantastic for us. I hope it was a good experience for you. It was very useful for us to hear from the municipal and all the RHDs and so on. So that's great, yeah. Question? Mike, over here.
I was speaking to Hereditary Chief Richard George from Ahousaht and hoped that he could be here tonight. One of the questions he had, and I know it's not your problem, you talk about, and Dr. Enns had, Charmaine, sorry, the alcohol problem, especially in Ahousaht area. And Richard wondered why there's a limit on a restaurant or a resort on how much liquor they can buy, and yet people walk in there and come out with 5 cases of liquor. I don't, you know, I mean, that's where your alcohol problem comes in.
Yeah. Well, I remember visiting Nunavut when it was first opened, and they have a no alcohol can come into the community policy. But somehow it got there. It was pretty amazing. Yeah. So I don't know, unless anyone else has an answer to your question. I don't know what the answer is, but I agree with you. It's a big, big problem.
Tom, do you know?
I can give a brief
Okay, perfect.
explanation. One of the questions that has come up and that we are trying to address with Hashikamis Richard George was the prevalence. And so it's the Liquor Control and Regulation Branch that controls and regulates the sale of alcohol. And so when we approach them with the conversation around the major issue of bootlegging up in Ahousaht to address some of those concerns, we looked at what possibilities there were. So we went to the Liquor Control and Regulation Branch, who, as we know, are the regulators of that. And so when we were told that basically there was not, it is the law of the land. If you're 19 years old and not intoxicated, you can purchase as much as you would like. So there's no definitive answer. So we looked at the local level, at the municipal level, if there were ways that we were able to, through the business licensing, the only area that we would have any control over is through the business licensing. So at our local, it's just down the road here, we had to consult with our lawyers, and there is this remote possibility of that control. But what it posed the question was, at the LCRB, then you would have a government liquor store that would be able to continue in the sale in the numbers that they were allowed to sell at. So it would be deemed as unfair competition. There would be legal challenges, et cetera, et cetera. So I went back to the LCRB, Erin McEwen, she's a wonderful lady. She said, if those bylaws, they could align them with the province could make exceptions. It is an incredibly difficult regulatory process to have that enacted. So it's still an ongoing conversation. It's not dead, but I can tell you, as many of us know here, sometimes these things move at extreme glacial paces. So it is challenging to get immediate answers to problems that we know exist. And it is one piece of that puzzle, and it's multi-layered, multifaceted, and this was just one layer of multi-layers that would have to be moving in tandem to address what is a major issue in not just in Ahousaht, but in our communities in general.
Yeah, right. Thanks, Tom. I suspect that most of the people in this room share your concerns, but you heard what Tom said. It's like climbing a mountain, right? Just a real shame, but the reality of. Hi there.
Good evening, everybody. Oklas Luchin Suta Hashquiaksups. My English name is Mariah Charlson. My Ko'as name is Luchin Suta. I am from the Heshkut First Nation, and I really honor and thank Dr. Enns for your presentation. And when we see the demographics in front of us and seeing the outcomes, I think it would be really interesting, and I think that it would actually be quite drastic if one of those lines was the outcomes of our First Nations represented in this region. And my guess is that when we talk about the alcohol, when we talk about the opioid crisis, that many of the people who have been harshly impacted are those that are First Nations and from these communities. I know that because those are our relatives that we have lost. Those are our brothers and sisters that are being impacted. And when we think about our health outcomes being so much lower than that of the greater population, I think about the In Plain Sight report and really calling on some serious recommendations. And I'm curious if this region is responding to those recommendations in the In Plain Sight report, and if there's a regional approach, because we know that there's 202 First Nations in British Columbia. We know that the 5 nations in this specific region are unique. The community I grew up in and the community I've just moved back home to, we are considered rural and remote. We currently do not have a doctor that comes into our community. That means that all of our residents of Hot Springs Cove, if they want to see a doctor, if they want to see a nurse, they have to come and they have to receive supports from Island Health. Many of our people are what we are now referring to as warriors. They're survivors of the Indian residential school system. They're not comfortable in an institution such as a hospital. So that's why I asked that question. Is there a regional specific strategy to accommodating and responding to these recommendations in the In Plain Sight report? Because these are going to have huge impacts on our social determinants of health. Thank you. True.
Thank you very much.
Thank you, Mariah. And just thank you for being a warrior. I know the hard work that you're doing for the community and for many of the nations in the New Chalmers family, and just want to raise my hands to you for the work that you do. So for those of you who don't know about the In Plain Sight report in the room, we've had a review of the experience of systemic racism in the healthcare system in British Columbia. 28 recommendations for change were made in that report. Some of them are at the organization, at the care level. Some of those recommendations are at the organizational level, and some of those are at the system level, so with government and other governmental partners. We have a work plan that works at some of the recommendations at that organizational level or at the care level. And much like Dr. Enns has presented, the work that's been done has been really around the Alberni-Clayoquot region. One of the things I spoke to was the primary care initiative that's led, FNHA, as leading 3 different primary care initiatives, one for each of the families. And the New Chalmers work is here on the West Coast, so exactly to your point, access to primary care and to improve that access. We've also done quite a bit of work creating cultural safe ways to raise concerns, especially when the system has done harm, and to make sure that people are comfortable and that we can receive that feedback in a culturally safe way for patients and families. And then just to name here, both in the North Island and here in Port Alberni in the region, we're changing our leadership structure to have what we call a triad leadership, so that we have Indigenous leaders standing beside our administrative and medical leaders to make sure that we are doing the work that we do at a leadership level in a good way. And my colleague, Don Thomas, is sitting behind you as our Vice President of Indigenous Health. We've set a target to increase the number of Indigenous leaders across the whole organization, not just in the Indigenous health portfolio, because we know that in order to become a culturally safe place to receive care, we need to represent the faces of the community to make it safe. So those are just a few examples of what we're doing. And the journey will be long. So we know this work is going to take us some time, and then sometimes things happen quickly. So not to say we're giving ourselves a hall pass to take many, many years. We know that there is a sense of urgency to make sure that this system is safe for those who need it the most, and you've just named that. Healthcare, every person, every time we make that commitment, and we know those among us who have been harmed by systems, actually, we need to do even more work to make the system safe. So thanks for asking the question. I don't know, Dawn, if you'd like to add anything? Yeah?
Thanks. I too want to raise my hands and say Clayco for your strong voice and advocacy, Mariah, and just appreciate our partnership and working together. Just a couple things I wanted to add. One being that I think our greatest intervention that we received from the in-plain site report was the Indigenous liaison nurses. The province has funded 5. Island Health matched that 5, and then we continue to grow as a team because of the great feedback we get from staff and patients, Indigenous patients, around the ability to de-escalate, navigate, help support the system, create a safe system when our Indigenous families are accessing the acute sites. So that team continues to grow. I think we have 22 approximately now, and grew in a relatively short period of time from 2020 until now, and continuing to grow so that we can have 24/7 access. As you know, are well aware that often things happen in the middle of the night on the weekends when in the past we didn't have Indigenous liaison nurses, and so we're looking to fund those positions. Specifically at West Coast, we're hiring a knowledge keeper to also help with some of those when there's unsafe care at those sites, and an elder in residence at West Coast Journal as well. The in-plain site report, as you may remember, there was a task team that was in place for 2 years. Since that time, the VPs of Indigenous Health, so there's 7 now across the province, meet on a monthly basis to help implement the recommendations from in-plain site and see where that work is at from a systems perspective. And so we can learn from each other, from the other health authorities, what's happening in other regions, and we can share what we're doing on Vancouver Island. So that's been a really productive table. We'll report out on a yearly basis as where we're at, so that we can give updates on the recommendations. I think 13 of the recommendations were health authority specific, and we'll continue to report out through FNHA and other partners on where we're at Island Health with those 13 recommendations. Great, thanks.
Thank you so much. I can't tell you how important it was for you to stand up and speak to us and ask that question. So thank you very much for doing that. Other questions? Oops. Please go ahead. Well, here comes a mic.
You're talking about retention of health staff, nurses, doctors, and Charmaine was mentioning that it's $1.6 million to buy a home here. I'm just wondering what Island Health is going to do for housing to bring staff in and to have a place for them to stay and grow in the community.
I may ask my colleague Kim Carone, who's our CFO, to speak to the investments being made in that area. I'll just say it's a really tricky thing as an employer to provide housing to one group and not another group. So we have to be very careful about how much we lean into this housing solution. And that's where partnership is so important. So just to say that first, and then I'll hand over to the experts.
Yes. Thanks, Kathy, and thank you for your question. Housing is something that is new to Island Health, and we're exploring it in a few communities, including Tofino, and we have a plan. It's kind of entwined with the Sobering and Assessment Center, And right now we're looking at probably 6 units that we will be constructing solely for staff housing. But again, like I just want to emphasize, this is new for us. We're just venturing into it, so we still have to sort out who gets those units, how it's going to work. But we do recognize the problem, and that's why we have put it on our plan.
And just to say, we're quite lucky because of the initiatives that the province is undertaking around housing. So it allows us to partner with BC Housing in some of the investments that they've made, and also the targets they set for certain communities. So all of that's coming together and helping move that agenda along.
So just on the topic of attracting, retaining, and recruiting staff, in her comments, Kathy noted that rural and remote healthcare employee incentives are available to help attract new staff to our West Coast sites. And housing, I thank you for asking that question. So a common question that I hear from communities when I meet with them is, how do we know these incentives are effective now or will be in the future, and are they enough? So the incentives we have here are the same incentives used to attract staff to the communities of Port Hardy and Port MacNeil. And I was wondering if, James, you might, as you're the vice president for that region, or Max, you could call on your colleagues too, could share a few words on how the incentives have helped recruit staff for work in the North Island.
Yeah, thanks very much, and really appreciate the question around the accommodations and temporary accommodations. We know that it's challenging when you're thinking about living in rural or remote communities to be able to find a place to live and to be able to enter that community. So the great work that Kim spoke to around accommodations, I think, will be one of those pieces that's going to really help us with recruitment. When it comes to the rural and remote incentives, we're really quite fortunate to have been able to partner with the Ministry of Health to be able to pilot and test really innovative and new retention incentives in the North Island. We've been doing that over the last year, and we've received really positive feedback. So James, myself, we tour those sites often, and we talk to staff and physicians, and we say, how are those incentives? How are you liking them? Are there pieces about those incentives that we can change? And we're hearing all the time, including in our our stay conversations that we have with staff as well, that there's a great appreciation to those incentives. The way that the incentives work within the North Island is that you get a retention bonus or a retention stipend based on how much you're working. And the stipends are built in a way where it asks people to take positions with Island Health, and then when you're working within those positions, every 3 months you receive a stipend to say thank you for your continued effort in working within the organization. And they've had a tremendous positive impact. Most recently, the Ministry of Health is looking at expanding those retention benefits across more rural and remote locations, and that'll include Tofino and the West Coast. And we're just waiting to see how those will look and official announcements from the ministry. But it's a great question, Leah. They've been extremely positive and super excited about the expansion of those benefits, and very thankful to the ministry for allowing us to pilot those in the North Island.
Great. Thanks so much, Max. So stay tuned. Anything? Go ahead.
Hello there. Thank you very much for allowing me to speak. I am currently a patient of the Vancouver healthcare system, Vancouver Island healthcare system, and I think I'm being treated fairly well, except for one thing, and that is the wait time. And nobody is telling you what's going on next. So you are literally feeling as though there is a knife in your side, twisting. And your brain is going, am I going to live or am I going to die? Because that is how critical it is. Now this comes back down to all these people concerned about alcohol. They are not getting help either. And so they say, what the heck? Why don't I have another drink? And for myself, my care has been good, except I know I have missed the window for a cure.
Thank you, and I'm sorry. I'm sorry that that's been the experience, and we know the impact Charmaine spoke about what I call the harms of the pandemic. The increased wait times for care is one of those impacts. So we do know that our surgical wait times have grown. Our volumes have actually increased. So our ability to do more surgeries, we're doing more surgeries now than we did last year and more than the year before that. The problem is the demand has also grown in a greater way. So, and we can use that across every domain, as you've just identified: mental health, substance use, our wait times for long-term care. So we are really, I think, working hard in the environment where our staff are, we have vacancies. So we're just mindful of trying to keep our staff going and not kind of burn them out at both ends. And I know that's the experience that many have at any given time, and try and keep up with those wait times and that increasing demand. And so we do have targets that we are expected to meet every year, and we're working hard. Our teams are very committed to improve the way that we do care so that we can get more patients through with the services that we have. It's very challenging, though. We're experiencing it here in Vancouver Island, and I know most of Canada is experiencing this same challenge. Primary care is another good example. The numbers of people waiting to be attached to a primary care provider, despite the fact we've increased the number of primary care providers in the community. So very challenging times over the next probably couple of years until some of these investments that government has made in terms of additional seats in the schools, some of these recruitment and retention incentives, when we start to see the long-term payoff.
Thanks, Kathy. Go ahead.
The hospital foundation has a piece of property that adjoins to the hospital property, and it can be used for nothing except health care. Mm-hmm. That was the stipulation. So would it be possible to maybe put housing there for staff?
Kim?
Yeah, well, we'd have to understand what the covenant on the land is just to start with, and then we would go through a process of looking at what the covenant says and what the need is, and also the best use of the land. So it's really hard to answer that question without understanding that covenant or bringing into the needs assessment that we've done as part of our concept plan. But that certainly, looking at our concept plan and business plan, is something we can bring into and look at, yeah.
Thank you.
Thank you. I don't see any more hands. So as a governance board, we are accountable to you and the people we serve in these communities. And that's why it's so important to provide opportunities like this to hear from you. I want to thank you. All of you asked questions, all of you who came to join us this evening. And I don't think we got any questions online. So that is something that we often expect to get questions, but we didn't. Thank you to Kathy, Charmaine, and Faye for your presentations. I also want to thank the other staff who are here, because this is a difficult planning mechanism to get us here organized the way we're organized. So our multimedia staff, our communications staff, all the executive that come here to support these kinds of meetings. We're having this meeting, we're having a breakfast meeting tomorrow morning, and then we're having a meeting with a group of Indigenous people at lunchtime. So that all takes this whole group of people to get us here. So thank you very much for helping us do this. Otherwise, we wouldn't look nearly as well organized as I hope we appear to you now. So I'll close off the forum. Thank you very much for joining us. Go ahead. Just, here comes the mic.
I meant to mention that would it be possible to have the meeting at 7 o'clock instead of 6 o'clock? Would you get a better turnout? Are you happy with the turnout tonight?
Well,
I think there's a lot of
you
people.
know what's interesting about your question is we've tried every time, every day, every morning, every evening, everything. We've tried it all to make sure that we get the best group of people. But thank you for your suggestion, and we always take those into consideration for the next time that we plan something. So I think the one we had on Salt Spring was in the middle of the afternoon, right? So yeah, it depends, and we try to do a bit of a recce of the community to see what would work best for them. So yeah, I hear you. Thank you.
Thank you.
Thanks very much. So the forum is closed. Thank you very much for joining us. This has been really productive, and we'll see you over time and sometime again. Thanks.